So discussions here still were around the peer education model, and here we were able to have the ADHO, who was part of the peer educators training initially, and she confirmed that the peers are making a lot of contribution in terms of information dissemination, but also referring the young people for services at the facilities.
I first want to appreciate Protect SRHR, especially the Richer Hand Uganda. It's one of my first time to have a longer period of working with IPs, because the districts where I've been working, it's like Maracha without implementing partners. You do your things within that district. When an IP comes, it's like 1 year it is gone, and you don't see them come back to look for the results of the work done. However, with the Richer Hand Uganda, we want to appreciate you, first of all, for the services, for having chosen Maracha. It's not in vain. Indeed, Maracha had issues with the adolescents and the youths, but when they came in, I've seen general, the eyes of several youths are opened up to see what is happening in other places, and that they are left behind and they need to wake up. That one, you can see it in how they are behaving among themselves, especially with the peer educators who are trained. People like Moses here, you got, not Moses, Morris. You see them in the schools with the nurses from our facilities, all going to meet these youths, or they come to the health facilities. Their discussions they are free. They are able to discuss. Even me personally, I've been moving to schools within Maracha here, not always, but also even in the church. When you meet adolescents, you are able to discuss and able to tell you that yes, our leader is so and so. That means they know these peer educators, especially those who are fairly informed. But the challenge is with those who are deep in the village. At times they fear to come up like other people because of the factors like you don't have a clean dress, you don't have anyone to support you to come out. So you end up hiding in the village there. If they tell you to come to the health center for here, you fail to come because you don't have a decent dress. But it's a very good initiative looking for these people. I also want to appreciate you for the leadership of the Richer Hand Uganda. I think he has been moving in all the facilities where they're working. He monitors them, he supervises them so much. Also not alone, but involves the health facilities. That means it is district-led program. It's not his own program. So through Joas and other colleagues, I think our relationship has been okay.
Just like in Koboko District, Maracha District also conducted a data quality assessment, and the team was trying to address issues of documentation. And then the other element that we saw also increases, we were at 16% family planning uptake, but right now we have pushed it to 18%, in which we think is a positive contribution from Richer Hand International. But I see our greatest problem could be documentation. Despite the registry that the IP helped to produce, to track, especially those who accessed services, there's lack of integration of that information into the main DHS2 or what is at the facility. So to be precise, IRC Protect, not IRC Protect, but Protect Sexual Reproductive Health, supported data quality assessment, and we did interswitch. The biostat of Koboko came here, and I went to Koboko. So one of the indicators we were so deliberate at was the number of adolescents who accessed adolescent services. So her findings about the district is that much as the services are being offered, they are not documented properly and reported properly. And they pledge to continue mentoring and supporting the health workers at the facilities and the different members that support this documentation to ensure that these numbers eventually reflect in DHIS2. The contribution of the peer educators in terms of mobilizing the young mothers, the teenage mothers, and referring them for reintegration into school was highlighted by the officer from the Education Nexus, Lanyero Frida, and she appreciated this so much. However, she requested that if we can track the number of teenage mothers that are reintegrated into school that come through the peer educators, it would be something that would support in ensuring that whichever way they came in is strengthened so that we can see more young mothers or teenage mothers going back to school.